When you think of multiple sclerosis, a few things probably come to mind, right? Maybe fatigue or trouble walking. But one of the most common and honestly one of the toughest symptoms to deal with is pain. It's this invisible battle that really truly shapes the lives of people with MS. So let's get into it.
Look at that number, 63%. That's how many people with MS experience pain. We're not talking about some rare side effect here. This is a majority experience. For most people living with this disease, pain is just part of their reality. And this is a really key distinction to make. We tend to think of pain as a secondary thing, an outcome of something else. But in MS, it can be a primary symptom, caused directly by the disease itself. It shapes everything: daily life, work, relationships. It's not in the background, it is absolutely front and center. Wow. I mean, that quote just hits you, doesn't it? It gives you a real glimpse into the sheer intensity of MS pain. This isn't just some dull ache we're talking about. It can be sharp, electric, totally overwhelming. And that description is our way into understanding the different kinds of pain people are dealing with. So let's start with the first big category: neuropathic pain. This is pain that comes directly from damage to the nervous system. You see, when MS attacks the protective coating around nerve fibers, the myelin, the signals get all scrambled. It's like faulty wiring, and the brain interprets all that short-circuiting as pain. To really understand this, let me tell you about a woman named Hope. Her story just shows how this neuropathic pain can turn the simplest, most gentle things like her husband's touch into pure agony. There's actually a name for this, when a non-painful touch causes intense pain. It's called allodynia, and it's a hallmark of this kind of nerve damage.
And what Hope was going through? That also has a specific name: trigeminal neuralgia, or TN for short. It happens when an MS lesion messes with the trigeminal nerve, which is the nerve that handles sensation in your face. And get this, it's up to 400 times more common in people with MS. That's just a staggering statistic, and it really drives home the direct link between the disease and this very specific, very awful pain.
Okay, so this chart helps us map all this out. If you look at it, you can see how everything connects. See where trigeminal neuralgia fits? It's under intermittent neuropathic pain. All that means is that the pain comes straight from the nerves, and it hits in these sudden, horrible bursts. Now, another common nerve pain is something called Lermet's phenomenon. People describe it as a quick electric shock that shoots down their spine when they bend their neck. Putting it side by side with TN shows you the most important point here. The location of the MS lesion determines the type of pain you feel. A lesion in one spot causes face pain. A lesion in another spot causes that shock down the spine.
But, not all pain in MS is about these directly damaged sensory nerves. Sometimes the pain is more of a secondary effect, a consequence of how MS impacts the muscles and the body's whole framework. And that brings us to our second big category of pain.
Let me introduce you to Denny. His story gets us into the world of spasticity, a really common motor symptom in MS that brings a whole different kind of pain. His joke is pretty relatable, but the problem underneath it is serious. We're talking uncontrollable muscle stiffness, cramps, the works.
So, what exactly is spasticity? Well, it's what happens when MS lesions damage the motor pathways, the ones that control how your muscles move. Without the right signals coming from the brain, the muscles basically go into overdrive. That's what leads to that intense stiffness and the painful, involuntary spasms that Denny was talking about.
And if we pop back to our chart here, you can see that spasticity pain is in a totally different category. It's a musculoskeletal pain. The problem isn't the sensory nerve misfiring, it's the muscles themselves reacting to bad motor signals. And that's why figuring out which type of pain it is so important for getting the right treatment. A really classic example of this is the MS hug. And trust me, it's not a comforting embrace. It's this awful, tight, crushing feeling around your chest. And it's caused by the tiny little muscles between your ribs all going into spasm at once. It's a perfect, if terrible, example of how damage to those motor pathways can create this really distinct and distressing pain. All right, now we're going to talk about some pain syndromes that are less common, but they are incredibly severe. They show just how profoundly MS can, rewire the body and transform sensations in ways that are pretty hard to even imagine. This is a direct quote from a patient named Taylor.
She's describing how an MS lesion in her spinal cord completely transformed what should be an intimate, pleasurable moment into an intensely painful electrical explosion.
It's a sobering reminder of how deeply personal and invasive this kind of neuropathic pain can be. It doesn't just mess with your arms or your legs, it can fundamentally change the most human of experiences.
And here's another one. Another raw, visceral description, this time from a patient named Julie. She's talking about a rare condition called glossopharyngeal neuralgia, and the pain is triggered by the simplest things, like swallowing or talking.
So what's going on here?
Well, it's an MS lesion in a very, very specific spot in the brainstem that's causing this particular nerve to just fire like crazy. It's another powerful, chilling example of how a tiny bit of damage can create a massive, highly targeted, and excruciating pain syndrome.
Okay, so you hear about all these different awful types of pain, and the big question is, what can you do about it? Well, the most important thing to know is that there is no one-size-fits-all answer. The very first step is always to figure out exactly what type of pain it is, because you treat nerve pain very differently than you treat muscle spasms. So let's take a look at the toolbox. When it comes to medication, the approach has to be super targeted. If the problem is a nerve that's firing like a faulty wire, like in trigeminal neuralgia, doctors might use something called a membrane stabilizer to kind of insulate that wire and calm it down. But if the problem is muscle spasticity, then muscle relaxants are what you need. You see? The goal is always to match the tool to the source of the problem. But it's not all about pills. A huge piece of managing pain is rehabilitation. Physical therapy and specific stretches can help with spasticity. Things like a TENS unit can actually interfere with the pain signals. And psychological support is absolutely vital for learning how to cope. For the most severe, stubborn cases, like Hope's trigeminal neuralgia we talked about earlier, neurosurgery can even be an option. It really brings her story full circle.
So this brings us to a much bigger question. After we've looked at all the physical stuff, the lesions, the nerves, the muscles, we have to ask, is that the whole story? Is pain really just a physical sensation? And the answer, we now know, is a definite no. We have to look at the bigger picture, which is what this biopsychosocial model is all about. It shows us that how we experience pain isn't just a physical signal. It's massively shaped by our thoughts, our emotions, and our behaviors. For instance, if you're constantly thinking the worst-case scenario about your pain, that can literally make the pain feel worse. This whole interaction is a critical piece of the puzzle.
At the end of the day, pain in MS is a deeply personal and invisible battle. Understanding all its different forms, from those misfiring nerves to spasming muscles, and recognizing that our minds play a huge role, that's the first step. The real challenge for patients, for doctors, for all of us really, is to find better ways to see it, to validate it, and finally, to manage it.